And the demand for advanced nursing leaders across our islands has never been greater, and Chaminade University is stepping up to meet that need. Their online Doctor of Nursing practice program allows working nurses to advance their careers and lead healthcare innovation. Plus, to address Hawaiʻi's critical shortage of mental health providers, select students entering the psychiatric mental health specialization can qualify for a stipend to help cover tuition. Let's take a look at how Chaminade is preparing the next generation of healthcare leaders.
I grew up in a family of healthcare workers, and I had a passion for helping others and knew that I could do it as a career. But I knew that I wanted to do a non-traditional nursing path. During my undergrad, I was inspired with my psychology class. I minored in psychology, and then during my first year of my nursing career, I shadowed and worked under a psychiatrist and a nurse practitioner doing street medicine. That opened my eyes to see how impactful mental health is on a person, both positively and negatively. A lot of people wanted to seek mental health, especially here in Hawaii. There's a shortage of psychiatric providers.
We launched our DNP program in 2021 in response to workforce needs. There's a large shortage of providers nationally and here in our state in Hawaii. And so we created the program to educate nurses to become advanced practice providers and leaders in order to better serve our community. We're really fortunate to have received a HRSA grant for our psychiatric mental health nurse practitioner track. That grant, which is $2.34 million over the course of 4 years, provides additional support for students. We're able to provide a $32,500 stipend to selected students to alleviate some of their financial burdens while they're going to school. It also provides them with an opportunity for additional clinical practicum experiences that will really enrich their education.
So the DNP program is 100% online. It allowed me to be very flexible with juggling work, spend time with my loved ones, and travel. The faculty were very supportive. They checked in on us as students to make sure that we weren't burning out. They were easy to communicate with through email and through text message. And our cohorts would be very small, so it was very intimate. We got to meet each other every year for our immersion. We got to network, have trainings, conferences, and pharmaceutical dinners that helped us to learn more about the medications that we'd prescribe, and also share each other's knowledge since we all come from different nursing backgrounds.
Our students here are not a number. We know each one of them and where they are in their pathway, and we also provide clinical placements for our students. Clinical placements are scarce and hard to find, and so what we do is we secure those clinical preceptors, physicians, nurse practitioners, and pair up the students with those preceptors so that the students can focus on their learning and not focus on hunting for a preceptor.
During my clinical hours, I spent hundreds of hours spending time with the vulnerable population, those who are with addiction, houseless, children, adults, kupunas. I was able to kind of embody that holistic care in the community. For me, it's a full circle. I'm able to live out the Marinese values and the Hawaiian values and be a provider and a nurse, embodying that holistic care for the community. It shapes me with my work ethics and how I treat other people. So I wanted to be an advocate and help be an asset to our community, being a mental health provider.
If you're interested in learning more about our MSN program or our DNP program or our HRSA-funded psychiatric mental health DNP opportunity, please don't hesitate to reach out anytime. You can find us at chaminade.edu.